physicians engaging in games. Just a couple of words about ourselves. We are a professional community for Russian-speaking physicians. We currently have about 80,000 members. A majority of them, about 80%, come from Russia. The rest comes from the rest of the world. But we also, a majority of countries are the former Soviet Union countries, which have the big proportion of the population that speaks Russian, so they've got quite a few doctors that joined our community as well. So over the last 2 days, there's been lots of discussions, and I think it is, I can make a point that quite often we have heard the word engagement. When we talk about social media, be it patient social media or doctor social media, doctor-oriented social media, it is very important to engage the audience, to make sure that the audience is motivated to get back, to engage in conversations, to share the data. So we fully agree with this notion, and we actually constantly searching for new ways to engage physicians within our community. There are lots of gaming platforms. We've heard a lot about them, about the Serum, platforms for direct-to-consumer area. We've heard about Serum. There are lots of wonderful, absolutely exciting mobile apps to control chronic diseases, to help patients with diabetes. We've heard about engaging research communities in games, but there is not much about physicians. So how do we engage physicians? Because physicians do serious things, and it's sort of tricky. So games generally perceive as something which is maybe foolish, not very serious. So how the two combine, and do actually physicians play games? That's the big question. There's some statistics from our community. So the answer is yes, physicians do play games. When we started our community, we quite quickly spotted the trend that apart from discussing professional issues, clinical cases, difficult patients, physicians also started to play games. At the beginning, these were the very simple games like I Spy and something like that. It was sort of silly games in a way. But surprisingly, these attracted quite a lot of participation from physicians. So once we've spotted this trend, we decided to isolate this section for games, dedicated it just purely for entertainment for games, and see what comes out of it. So to date, we've got 45 games in this section. They are evolving over time. We've started to do this 3 years ago. So over the course of 3 years, we've got 45 games, which develop sort of from simple ones to more complicated and intellectual. We still see the same pattern with games having much more comments per game, on average 306 comments per game, compared to, I'd say, 50 to 80 for popular discussions of medical professional topics, which is sort of almost 5 to 6 times more. And in total, this activity is now over 15,000 hours. Physicians are spending their time, despite being busy, despite having lots of things to do. They are playing games. So I'm sure that those who plan marketing and educational campaign for physicians would envy these numbers. The absolute leader of the format, the game format at the moment, was inspired by a popular TV show. This show was very popular, local TV show, very popular in 1980s, 1990s. That's the show where the team of intellectuals would get together, and they would play live against the general public who send their questions, and this team has to find an answer to these questions within 1 minute. So these series were very popular, And the game that we have, as I said, it was inspired by this TV show. Well, our game is called I Erudite, and the idea is, because we are in the digital format, so the idea was to put questions again, just set the limit for looking for an answer, and then come up with an answer and see if you got this right. So at the beginning, physicians started to play this against each other, and quite quickly we were quite fascinated to see what came out of it. Because in the age of Google, it's not the challenge is not only to find the right answer, but also to find the right question. So it's not that easy to Google the answer within 3 seconds. So the questions should be sort of more of the research nature that would encourage members participating in a game to do some research and thinking and apply sort of logistics to deduct the correct answer. So we're discussing this game with our partners who do social network for medical representatives, and they said, oh, how interesting, because we have our members do play games as well. So we decided to combine the two. And on the 10th of May, 2 teams, the doctor team from our platform and the medical reps team from this other social network, began to play. So here's the question. So the original question was a bit longer. That's actually the essence of the question. Which medical specialty can be defined by the expression, the fewer, the better? Any ideas? No. But in a game, you should have provide rationale behind your answer. So it's not just you put forward 2 words, clinical pharmacy, but you have to actually justify why is this and show the cases. Interestingly, this only questions, there were 7 questions similar to this one. This particular question triggered quite a few discussions in the scientific section of our platform, and doctors began to discuss the concept of polypharmacy. Is it good? Is it bad? How is this working? So it sort of it went beyond the boundaries of the sort of games section. So yesterday, this part of the game came to an end, and I'm proud to announce that the doctor team won over the medical representatives. But the most exciting bit, as of yesterday midnight, medical representatives who took part in this game and our doctors were discussing when they continue. So I think I'm able now to do a cautious conclusion to say that we've got on our hands a platform that bring voluntary doctors and medical representatives who are eager to interact and compete in intellectual challenge. So at the moment, it's purely a project that we do sort of for fun to see what comes out of it. But if you think from the standpoint of education and marketing, what this gives to us, I think that's breathtaking. So to conclude, we had a game within our community, doctors playing against doctors. Now we've got to the next level where doctors began, one social platform network began to play against the other social network. So I wonder what comes next. Maybe we'll start play this game internationally. So if anyone is interested, please let me know. Thank you.